All right, so I'm here today with the team from ASDA, who is very close to my heart because we are all about dental AI and innovation. So do you guys just want to first introduce yourselves and then we can talk about ASDA? And tell me why you started ASDA.
So I'm Jeremy Pack. I am a general dentist. I've been working for about 5 years now and I work in Pennant Hills.
I'm Dr. Selena. I am a general dentist. I've been graduated for 6 years now and I work around the Carlingford, Dundas area.
Why ASDA? What made you start this? Because it is the only AI society in dental. So why did you start this?
It's a great question. I think for us and just seeing how AI is revolutionizing a whole lot of different spaces in society, in the workplace as well. Dental was bound to happen, and we're already seeing that in software, in workflows. And so I think we wanted to be part of this society and learn and also encourage others to see how AI has a place in the dental world, to be able to, I guess, future-proof our practice, as well as encourage a community to consider and think about how AI can be used in the right way and with the safeguards in place. So yeah, that's essentially why we've joined and kind of helping out with ASDA. Yeah.
For myself, I'm very excited to see how AI can be utilised to help improve patient outcomes, whether it be with diagnosis, communication, increasing their understanding of the conditions they have, also with the ability to analyse data and from that sort of get recommendations and better sort of longitudinal data and sort of what parameters can be focused on to improve patient outcomes.
Amazing. So, thank you. So, talk to me about ASDA and what have you done already? Because you've been going for just over a year. So, for those people that don't actually know who ASDA are, talk about what you've done, and then I'm going to ask you what's coming. So, what have you done so far?
Sure. So at ASDA, we've had multiple meetings throughout the year. We've had about 4, and we have an exciting one coming up, the summit. Each time we meet up, it's fantastic. Like-minded dentists are connecting. We have a community of really kind but also very passionate dentists that want to achieve the best in their workplaces, whether that be with efficient workflows or also with communicating with their patients and staying ahead of the game. We've had people come in and talk about 3D printing. We've had Professor Axel Spahr come in and talk about how AI can be helping with the diagnosis of periodontal disease and the implications for that in regards to utilising scans and CBCT data to ensure that we know the longevity of or the prognosis of a tooth and potentially implications for treatment management options for that patient. Yeah, it's been a very exciting space. I'll let Dr. Jeremy talk about the upcoming summit, which I'm very excited for.
Yeah, so the summit is actually something that we've introduced for this year, and it's a one-day on the 20th of June, which is a Saturday, and essentially we've got a whole lineup of speakers, and they'll be speaking on various kind of categories or spaces of AI. Some of it talking more in terms of technical skills, how to actually implement it from a practical standpoint. Others talking more from a legal side as well, which is obviously very important for us. So there's a whole kind of array of things happening on that day, as well as a panel. And the panel's got some really spicy speakers. They're willing to say their opinions and not shy away from things, which I think is great. And I think that's the kind of environment that we wanted to create so that we can have these open conversations and actually talk about, you know, the dangers and the risks, the benefits, and actually how to be able to implement that well. Yeah.
Yeah, and I'm going to echo the spicy conversations that I was at the last meeting, and it's held once a quarter. And the conversations were rigorous. But in this world of AI and innovation, as you said, we need to have these conversations. For the industry, for the profession, we need to be talking about this. And for me, the thing I love about what you're doing is it's regular. That it's every quarter, you're getting the experts in, you're talking about innovation, but also guardrails, what is right for the industry. So for me, I think what you guys are doing is incredible. Okay, so I've been talking to lots of people in the industry today, and the question I'm asking everybody is, where do you see the industry, the profession in 5 years' time?
Oh, very exciting.
This is
5 years.
yeah, and no warning with this one. So
Like, just like with AI or anything?
with
like
AI.
that? Oh, with
So-
AI? Okay.
or across the boards.
Ooh, okay. I'll say something.
Look, I when I first joined the society, I read the AI 2027 paper and watched a YouTube video as well, and I was scared out of my mind. So I think, I don't know, the potential of AI is just huge. I think the challenges come with how to actually implement that with kind of the guardrails of the legal side aspect, but I think just efficiency will grow heaps. It will be quite scary, I think, in terms of maybe when it comes to even something like receptionists and using AI receptionists, but whether the low-hanging fruit can be taken over by the role of AI and instead we can focus the time and energy for patient care.
Patient experience.
And exactly, that's right. And so overall, I think it will be great in terms of how it's implemented, or that there'll be so much potential. I think it's just how do we make sure that we're safe with it. Yeah, that's probably my thoughts.
I don't know if it's going to be in 5 years, but I'm looking forward to how AI will, to some extent, help a lot with diagnosis and take away the subjectivity that a lot of, I think the profession suffers from, in the sense that for a patient, they will see one dentist and they'll be told one thing, and they'll see another and told another. And it's not that it's the wrong opinion necessarily, but it's that varied response because of personal experiences that patients, I think, have a lot of distrust for the profession overall. And I think that's what's really exciting about, like, with the integration of maybe AI with scanner systems, they'd be able to scan it and, for instance, be like, you have a gingival recession in this category. A lot of less subjectivity, as opposed to just, oh, I went to a checkup and the dentist said everything's fine. I went to another dentist and now they're saying that I've got gingival recession XYZ regions. So I think, as well as Dr. Jeremy was talking about in regards to like data collection and like efficiencies, potentially because AI will be able to input all the data from the radiographs, from the scans, from the intraoral photos, you could probably like generate something that the patient gets a really comprehensive understanding. Maybe it be like a report XYZ that's therefore allows them to take control as to what the issue is for them, and for them they could also put in a priority list for their personal wishes of what they care about. So if aesthetics is low, then technically, whilst AI might pick up that they've got gingival recession, if they've ticked they've got zero sensitivity, then actually discussing that gingival recession other than prevention, restorative might not necessarily be of a high priority for them. So I think it'll help us tailor treatment plans for them. That's just sort of where my mind goes.
I agree.
Sorry, I might add as well. I think the other thing that we've stressed a lot is it's not dentists or the profession versus AI, and that AI will take over, but it's actually dentists versus dentists who use AI. Similar to digital dentistry, and we see now how much scanners and 3D printers and all that has come into play, and that's still evolving. It's interesting to see how those who have kind of taken that on so early in their career, or even just later in their career, but trying to implement those kind of innovations. And we're seeing now that it seems to be just as good, not maybe even better than traditional methods. So same with AI. I think being someone who can use AI will just kind of really kind of speed run your career and profession as well. But yeah.
Yeah, like just to add to that, I don't think AI will replace the dentist.
No.
I think the dentist will still be responsible for the patient care and a lot of the patient's outcomes, but it'll be like a second check of what it is. So we'll be looking at the x-rays as well, but on top of that, AI can be there as well to highlight areas or things that we may have missed and help us to sort of, I think it's pretty fascinating even with its ability to like know with such accuracy, like the difference between the radiolucent lesions, like with to great accuracy, it can determine between like a keratocyst versus an ameloblastoma. And so I think like, you know, we just don't have that skill, and it's showing that to a great degree it's so much more accurate than us. So I'm very excited to use it as an adjunct to help us in our delivery of care.
Amazing.
Thank you.
Thank you, guys.
Thank
That's
you.
all right. Thank you.
Thank you. Brilliant.